All right. Good morning, everyone. Happy Monday, last day of March, March 31st. Thank you for joining us at our partner meeting. Today, we're going to be focusing on caregiving, Alzheimer's disease, and other dementias. And I see a few of you here that have participated in some of our other meetings, as well as our monthly Inland Coalition on Aging meetings. So if you can please put in the chat your name, the organization you're with, that would be great. Um, this meeting is to give you more information on goal 3, because right now we're looking for partners or organizations that we can collaborate with to implement the plan once it's finalized in June. So our consultant, Elizabeth Bogomil, will be presenting to you on the process so far, if you're not familiar. Also, she'll review the goal 3 that we have and then talk to you about potential partnership opportunities. So I'll go ahead and turn it over to Elizabeth.
Hello, everyone. Thank you so much for putting your information in the chat, your name and your organization. That's really helpful, and hopefully it'll get us thinking about ideas and ways that we can partner. So today we'll be talking about partnership for Goal 3, which is focused on caregiving and Alzheimer's disease, as well as other dementias. So we'll paint a little roadmap of how we got to the Inland Empire Master Plan for Aging, and then we'll review the timeline and also our framework for implementation. We will briefly discuss the other goal areas that we're going to be implementing, but today we'll be focusing on caregiving, Alzheimer's, and dementias. And then we'll discuss, and this is the bulk of the conversation, opportunities for partnership and implementation. And we'll talk about what that could look like. Keep in mind, these are just brainstorms of what it could look like. It can take many different forms, and we're open to the forms that y'all think would be useful for partnership as well. And then we'll discuss next steps and what next steps look like. So first, we'll give a little overview about the Master Plan for Aging on the state level. So the IE Master Plan for Aging complements the California Master Plan for Aging, and the California Master Plan for Aging is a 10-year blueprint for promoting healthy aging and supporting quality of life. It was launched in January 2021 by the Newsom administration under an executive order. And it was able to be developed to use with a framework of 5 goals. And so these are the statewide goals: housing for all ages and stages, health reimagined, inclusion, equity, not isolation, caregiving that works, and affording aging. And notice that these are the state goals, and some of them align with our regional goals and some do not. And that's okay, because within each of the regions of California, we're developing these master plans, they have different needs. And that's what we recognized. And so that's why the needs are tailored to the regions. Next, we'll talk a little about those regional plans. So, the California Master Plan for Aging released a local playbook, and the local playbook was almost like guidelines or instructions on how regions, whether they be cities or counties or coalitions within counties, across multiple counties, could create their own local master plans for aging. And improve aging within the community and meet the unique needs of their community members, because California is a big state, and the needs of community members vary by region and population. So we've talked about the master plan for aging, but we haven't really discussed what that is. And so our next slide will discuss what the master plan for aging is. It's a multi-sector approach to transforming human service systems to meet our needs as we age. And so what's really important here is this multi-sector approach. It means it's not just looking at human services. It's not just looking at the Department of Aging for support. It's looking across all sectors. And additionally, it's has the aim of partnering with government, private, and nonprofits too. So it's not just across multiple sectors, but it's also looking to partner across multiple domains. It's not just government-led, it's not just nonprofit-led, it's not just private-led, it's coordinating all of these efforts together. Some examples of priorities for master plans could be housing, long-term care or LTSS, caregiving, transportation, community safety and livability, legal services, healthcare, financial security. These are examples of what some master plans include. Um, they are not going to include all of the same elements, just as we saw with the state master plan. They don't include all of these elements here. Maybe in some of their subcategories they do. But that's because the goal for these master plans is to meet the needs of the population and community members in their region. And so that's why the priorities may change by region. Why are we creating a master plan for the Inland Empire, though? Why does this even matter? Um, so the Inland Empire is in a really interesting and unique spot. So by 2060, the population aged 65 and over is going to increase 682% in the Inland Empire across San Bernardino and Riverside counties. That's the biggest increase in the population of 65 and older across the whole state of California. It's a massive increase. And so it's important to be ready for that increase in those who are 65 and older with a plan. What kind of plan? The master plan for aging. And so that's why it's so important that we develop this plan ahead of time so that we can meet the needs of those who are coming of age in 2060. So the Inland Coalition on Aging formed to help meet these needs and to develop this master plan. It was previously called the IELTSS Coalition, and it was formed in 2008. So it's been around for a while. And different coalition members have been participating in Riverside and San Bernardino counties across this coalition for a while. However, we just recently changed the name to better be able to target and describe what we're aiming for, which is a coalition on aging and to make aging a increased and better experience for those in Riverside and San Bernardino counties. So the mission is to improve integrated care and service delivery across long-term services and supports in the Inland Empire. And the vision is a community where older adults, adults with disabilities, and caregivers all can age well. We have a board, and you may recognize some of the board members there. Carmen Estrada introduced us just at the beginning of the meeting. We also have Ben Haggerty from IEHP. We have Anna Swartz from Community Access Center, and then we also have representatives from both San Bernardino and Riverside counties. So this really is a cross-county collaboration. So when we were planning our own Inland Empire Master Plan for Aging, we applied for the Scan Foundation grant, and they were able to provide a grant, and that grant helped develop the initial underpinnings of the IE Master Plan for Aging. It focused primarily on the needs assessment and assessing what are the needs and what are the resources that are currently available in the Inland Empire for those who are aging, caregivers, and also those who are disabled. We received this grant in January 2022. And then in May 2023, we also received a grant from the California Department of Aging to develop the IE-MPA implementation plan, which is what we're going to be talking about today, the actual plan for making the community better, the action items. In September 2023, we released the IE-MPA recommendations report. This was the needs assessment that was funded by the SCAN Foundation, where we were able to get kind of a baseline assessment of what's available and what's needed within the Inland Empire Master Plan, or the Inland Empire, to improve the community for aging and those who are disabled and caregivers. And then in January 2024, we began developing this implementation plan. This is the element that was funded by the California Department of Aging. And we developed 4 working groups. One of the working groups, the end result is what we're going to be talking about today. So caregiving, Alzheimer's, and other dementias is the key focus of one of those working groups. We also have working groups that focus on transportation, housing, and social support and behavioral health. And in September 2024, we released the implementation plan draft framework. So kind of an overview framework of where we're going to be going next. And now we're releasing in June, the more detailed implementation plan. So hopefully you all can sign up and be able to attend the release for that. To develop the master plan for aging, we had an advisory committee that was part of this Inland Coalition on Aging. You may recognize some of the names on the advisory committee, particularly Susan Howland, who is from the Alzheimer's Association. And we also have Carmen Estrada, who is part of the advisory committee, but is not listed here because she's part of the board of directors for the Inland Coalition on Aging. So those are the 2 of interest for this particular presentation. But we did have input from across the spectrum. So we had input from housing, and we had input from LGBTQ planning committees, and we had input from people who were on the California Commission on Aging. So everybody on the advisory committee was able to gather together and kind of help form this needs assessment and also help guide these working groups. So next we're going to talk about how, here we go, the needs assessment. Oh, there we go. So we talked a little about this needs assessment and kind of looking at what was needed within the community, and to be able to assess what was needed within the community, where gaps were and where strengths were, we held community listening sessions. Those were held from August 2022 until May 2024. You'll notice that last date, May 2024, is kind of late. It was after we released the needs assessment. And what's special about this is we held an additional listening session with those who were disabled to specifically hone in on their needs and to better include them in this implementation plan. The needs assessment was able to delve deep into these community members' experiences with navigating resources in San Bernardino and Riverside counties. So we spoke with each listening session group, which you'll see in the next slide. We had quite a few for an hour and a half, and we were able to go quite deep into this discussion. We were also able to procure external surveys that were conducted with the Saboba Torres Martinez tribe, the Morongo Agua Caliente tribe, the Pachanga tribe, the Coyuya tribe, and the Santa Rosa Nation. And so we're able to pull the information from those external surveys and get further details on how these tribal nations are navigating aging, and see where that aligns with the experiences of those that we spoke with in our listening sessions. And the next slide will show you all of the populations that we spoke with. So we spoke with individuals in very rural areas. We talked with low-income individuals, those who identified as LGBTQIA, not just within that specifically focused listening session, but across many of the listening sessions. We also spoke with caregivers who were both English-speaking and Spanish-speaking, African Americans, Hispanic and Latinx individuals, veterans, those who are unhoused, and we were able to integrate the final listening session with adults with disabilities to really hear about their experiences and to learn about where challenges where accessing services were, and then also what was working for them too. In our listening sessions, we spoke about several topics. We spoke about transportation and housing and healthcare and behavioral health and social support, Alzheimer's and other dementias, and caregiving in general. Overall, across all of these conversations that we had, uh, a common theme was people were not taught that you're going to age. You have to plan for aging. And so that was something that came up quite frequently, like, oh my, I have to plan for this, but I'm already in the process of it. How do I do it? Where are the resources? We spoke with individuals about transportation who reflected on them not being able to stay in this particular part of California because the transportation was so challenging for them. We spoke with disabled individuals who felt like they had to be a legal library to advocate for their rights and to also educate providers on what their rights were. Um, we spoke with folks who were having a decreasingly in size social circle to be of people to connect with because their friends and their family members were passing away, and they were trying to figure out how to connect with community members to be able to engage socially. And then we also discussed broadly that when discussing extending life, it's also important to discuss quality of life. So it's not just about how long one can live, but what is the quality of one's experience as they're aging. And so all of these topics were really important. However, we narrowed them down um, to 4 distinct working groups. There we go. We had a working group that focused on housing, one that focused on behavioral health and social support, one that focused on transportation, and we also had one that focused on caregiving, Alzheimer's disease, and other dementias, which is what we're going to be discussing today. The co-chairs for that working group were Carmen Estrada and Susan Howland. And they were able to guide these suggestions for how to better improve the community for those who are caregiving and experiencing Alzheimer's and other dementias. However, it's important to note that although these are 4 discrete working groups, a lot of their topics do overlap. Transportation overlaps with all of these topics. Caregivers need transportation. When people's memory is starting to decline, sometimes their keys are taken away and they need to be able to access transportation or at least figure out how to navigate it. Those who are giving caregiving and receiving caregiving oftentimes need behavioral health and social support networks, which sometimes disappear as you're giving or receiving caregiving. And additionally, housing. Housing was a topic that overlapped quite a lot with caregiving. A lot of times, caregivers, once the person that they were supporting passes away or ends up in a professional care facility, they didn't have a place to live anymore because their housing was dependent on the person that they were caring for. And so a lot of times these topics do overlap, and that's important to realize when we're brainstorming ideas of how we can partner is your topic may overlap with some of these other topics, and that's totally okay. So where we are now and where are our next steps? So in January 2025, we released a draft of the MPA, the implementation plan for community comment. And in winter/spring 2025, where we are right now, we're building partnerships for implementation. We have quite a few partnerships already, and we're hoping to increase those with these outreach activities. Additionally, in June 2025, we are going to be releasing the IE-MPA. Hopefully, y'all are able to attend our event. Sign up at inlandaging.org to get the notifications. It should be, I believe, an online release event where we present the framework for the IE Master Plan for Aging. And then in 2025 to 2028, that's when we're planning actually doing the implementation work. So after we release the framework, probably starting at around August and going through 2028 is when we're going to work on the actual activities to help improve the community for those who are aging and caregiving and disabled. And so next we'll talk a little about the 5 goals for the Inland Empire Master Plan. Remember, I said that each community has its own unique needs. And so you'll notice some of these goals overlap with the state plan and some do not. For example, we have a focus on transportation, but the state plan did not. That's because transportation is a very big topic and was needed in our community and came up quite a bit. And so it's okay that there's not alignment, but there is a lot of work being done on many levels. That's something that is important to realize. So our 5 goals for the Inland Empire Master Plan for Aging are housing is home and healthcare, transportation for all ages, abilities, and regions, focus on caregiving, Alzheimer's disease, and dementias, age and disability friendly behavioral health and social support. And then this last one is unique because it came up in our conversations with the advisory committee and the Inland Coalition on Aging and across all of the working groups. There's a great need for a goal that focuses on safety, respect, and equity as one ages. And so we added in this last goal, even though we didn't have a specific working group to focus on it. The reason why I'm drawing attention to this last goal too is we do have a upcoming presentation for partnership on this last goal. And so I encourage everybody to sign up to attend that one because we don't necessarily have a working group to help spearhead it. And we'd like to be able to encourage a wide variety of participants and partners to contribute their ideas to the safety, respect, and equity as we age element. But for today, we're going to be talking about focus on caregiving, Alzheimer's disease, and other dementias. So this is goal 3, and we also have 3 strategies. The first strategy focuses on long-term care, or LTC. The second strategy focuses on caregiver support. And the third strategy focuses on Alzheimer's disease and other dementias. And so we're going to delve a little deeper into those. I'll talk about the first strategy. We have 2 objectives for this first strategy. It's to increase awareness among providers and consumers of long-term care services. So if you are attending this event and you are a long-term care provider, this is an objective that you can partner with. Or if you collaborate with long-term care providers at all. Additionally, there's 2 A's there. We need to change that. The second element is to support the capacity of long-term care services through advocacy efforts. So to help support this capacity, make sure it doesn't dwindle, make sure it can increase. Next, we'll move on to the second strategy. Oh, good. Those are labeled correct. A, B, C. The second strategy focuses on caregiver support. The first objective is to ensure that family and friend caregivers are aware of resources and how to access them. So this is an awareness focused component, just building awareness, communicating out into those who may be using these services. Next, we have for objective B is to connect providers with caregiver resources. So not just building awareness, but actually building the connection with providers and those who may need caregiver resources, such as those that ICRC offers. And additionally, the final objective is to incorporate caregiving considerations into housing, behavioral health, and transportation activities to strengthen caregiver support. Remember when I had explained earlier that this is a lot of like intersector collaboration and aligning of efforts? This is a key focus on how we can align efforts by understanding and incorporating those caregiver considerations into these other elements: housing, behavioral health, and transportation. And next, we are going to go on to our third strategy, focusing on Alzheimer's disease and other dementias. The first element is to build dementia capacity within existing systems. So oftentimes this awareness or capacity exists, but it just needs to be built out further. Those existing systems can be law enforcement, home care facilities, hospitals. It could be many different uh, systems, but figuring out how we can build out this capacity to better serve those who are caring for those with dementia and also facing dementia on their own. And then second is to build public awareness and education on early detection, diagnosis, and treatment. There's a lot of really innovative treatments that are available just recently. So if you can detect Alzheimer's and dementias early on enough, but people aren't aware of it, or there's stigma surrounding it, or there's simply a resistance to detecting. And so building awareness that this is available, that there's no shame in doing it, and then also awareness like this is something you can ask your doctor for, is really important. So the final slide discusses some ideas for partnership or opportunities for partnership. So one could distribute information to build awareness about caregiving and Alzheimer's. They could host trainings on caregiver support programs and tools to provide referrals. One could simply sign on as an organization or a leader whose work intersects with the well-being of caregivers, or as an organization participating in dementia capacity building efforts. So simply signing on and saying like, hey, we're already doing this. Like, let's figure out how we can share efforts. Applying for funding for projects focused on or including caregivers and those experiencing Alzheimer's or dementia. Um, so if we apply for funding, we're more than happy to help support that process. Oftentimes, if you're applying for funding, it looks really good to have a partnership that can strengthen an application. We can, it'd be good to sign on a partnership to facilitate cross-sector alignment of resources and planning. So simply being aware of like the resources that exist and figuring out how to plan across these sectors to support caregivers, also to support those who are providing supports for Alzheimer and dementia. Next, to participate in improvement services or a navigation. And to partner on early detection of cognitive decline, or to develop guidelines to include people living with Alzheimer's and dementia in behavioral support programs. That's an example of how you could work across sectors or across goals. Or finally, an idea for partnership could be to build an Alzheimer's, dementia, and brain health education campaign, which I know that we've already received Riverside's received the Healthy Brain Initiative grant. And so that's something that's already going on. And so being able to collaborate on projects that are already going on and existing projects, and acknowledging that with partnership, those projects can only become stronger, is a really important element. And so those are ideas for partnership. Um, I'm going to go through some actual partnerships that are currently happening, that are already happening with the Master Plan for Aging. They're across many different goals. That way you have an idea of what's already happening. While I'm doing that, in the chat, do you want to share any ideas of how your organization has work that aligns with the master plan, and potential areas that we could possibly partner, or ways that we could um, support one another? I am going to answer questions in a second, but I want to review the goals or not the goals, the projects that are already happening. Does that sound okay, Judith?
Yes.
Awesome. Okay. So I just while it's fresh in everybody's mind of the way that we can partner, I want to review what's already happening. So some projects that are already happening, and the ways that partners are supporting goals are for goal 5, which is safety, respect, and equity. Rolling Start already is doing safety presentations in the community. However, we've already partnered with them to apply for funding, which I believe we've received, right, Carmen? To expand their efforts and to distribute emergency supply bags. So we've already partnered in this application for funding, and that's an example of how we can support the funding process for maybe a project that you're already working on. Additionally, we're working with Justice and Aging and CCLTSS in finding individuals to share their stories about how medical cuts can impact them, or Medi-Cal cuts can impact them. And ICA and ICRC is coordinating on sharing these stories and connecting them with media and press conferences. And ICA is encouraging people to contact their representatives about Medi-Cal and the Older Americans Act. And so that all of that falls under Goal 5, which is safety, respect, and equity. For Goal 3, caregiving, Alzheimer's disease, and other dementias, ICRC is conducting training for Riverside IHSS providers and is also going to begin trainings in San Bernardino County through collaboration with their public authorities on caregiving supports. So that's something that's already going on with Goal 3. Also with Goal 3, Inland Coalition on Aging is going to be presenting at the San Bernardino IHSS Training Summit this month, which is, or well, no, in April, so next month. um, and that's quite exciting. For Goal 2, which focuses on transportation, PASTAC, which is a transportation group, is creating a user-friendly transportation guide for older adults and those with disabilities. It's being done in response and in collaboration with the Inland Empire Master Plan for Aging's goal on transportation. We met with them and we're continuing to meet with them, and that's how this collaboration came out. And finally, some of the partnerships can work across more than one goal. And so we talked about this, but this is how it can look. For example, ICA and ICRC are working with the Black Resource Directory and putting on a conference. So it happened in February, called What's Really Going On, where there's a panel of speakers addressing mental health and African Americans and resources available to them. And so this is an example of alignment with Goal 5, which is safety, respect, and equity, and Goal 4, which is behavioral health. So sometimes projects that are going on can align across multiple goals and multiple domains. So those are some examples. I don't see many ideas in the chat, but before we move on, let's have a conversation with Judith and anybody else who would like to share on maybe what the organizations are currently doing and some activities that y'all are currently doing in your organization that may align with the goals and the efforts that the IE-MPA has presented.
Yes, thank you. Actually, I raised my hand for an idea. So, two ideas come to mind. One is related to our efforts to help systems become age-friendly, which could target more than one of the goals. And this one is helping them apply. There's a recognition given that by the Institute of Healthcare Improvement, and it's focused on the 4 M's, asking the patient what matters, medication, mobility, and mentation, which entails screening for depression, for dementia, and for delirium. So this is something that we would love to partner with you to increase awareness of this work that we're doing at the Alzheimer's Association, and leverage your connections and your partners to uh, to get more systems to become age friendly. So, for example, we got Riverside University Health Systems to become age friendly level 2. So they even got the highest recognition. Um, but I know there's many FQHCs, many other hospitals that are not age friendly. So we would love to partner with with Euro to increase awareness about this opportunity. And the other idea that I had was related to dementia care navigation. The Alzheimer's Association is not working with um, Ripple Care. This is a services organization that is providing dementia care navigation services, and it's rolling out here to California this summer. So if we get more organizations aware, we'll get more people to be able to receive this services. So essentially getting a navigator to check in with the family on regular basis, connecting them to resources, answering questions, really decreasing attendance to ERs or hospitalizations, helping the caregiver have less stress because this navigation services have shown that it helps the caregiver tremendously. And we did a survey last year out of Facts and Figures focused on dementia care navigation, and caregivers said 97% said that they would love to receive more support related to navigation services. So I think those are the top two that come to mind, and I think that working with you and all the partners that you have would make it easier to implement and also to get to increase awareness.
Those programs sound really amazing and very incredibly useful just from a lot of the needs assessment that we've done. They sound like they'd really support people in the community. I want to call on Kamal, who raised their hand.
Thank you, Elizabeth. So, yeah, I'm Dr. Keshwal, and I'm with Kaiser Permanente SBC, San Bernardino County, and I'm glad that we are having this master plan of aging. And for this domain, three, we do get involved with a lot of support. Like we do the caregiver classes, we do inform a lot of caregiver information, how to self-manage when they are managing the patients with suffering for dementia. We do use the age-friendly framework in our Jerry clinic as well as in inpatient consult. But we definitely need the support for the county because with every dementia patient, there are like a two or three caregivers, which could be the informal caregiver at home, which may get burnt out and they need after our services. So, like all the caregiver education from this master plan of aging that we can provide and how to manage dementia. And then we can provide the help with the new treatment and advise them, but then they need like a lot of community support, how to manage their behavior, which is the next one part of it. But I think having the empowering the caregiver would be the great stuff from this. I'm looking forward because the burnt out is real for them and they do suffer from depression and other behavior issues, and while they're taking care of themselves they themselves get burnt out. And my other issue is sometimes there's an old person who's taking care of his demented wife and then he gets sick. What happens? What are the support system we have in our county to do this? So I'm looking forward for all this, and our providers and our team will be really helpful from whatever support we can do, or we can work together and collaborate on it.
Wonderful. And if I remember, Kamal, you're from Kaiser, right?
Yes, Kaiser Permanente Fontana. Yeah, SBC.
Wonderful. So, I mean, it sounds like we have quite a few health providers here. We also have IE-HP, who's on the board of ICA, and I know we've had a couple people from Loma Linda come in as well. So it's good to have all of those providers and resources together to be able to collaborate on ideas. I want to read Greg Damewood's idea. I have a couple of seniors and more of their friends mention having theft of items and maybe even some abuse. Does data need to be reviewed for best practices for those who are in home and isolated with caregiving? If there is no data, does it need to be collected? Well, this is a really good question. I don't know. Carmen.
Mhm. So the goal 5 focuses on safety and equity and respect. And so I think this concern here would fall under that on how to address abuse, financial abuse. And we're working with Riverside County Task Force on a lot of these situations that come up. They have monthly care team meetings where we're able to present cases about theft and different types of abuse. And so one of the main things for Goal 5 is to educate the community on what steps they can take to prevent this types of abuse and what to do if it happens. So definitely a concern that falls within our plan, specifically with Goal 5. So like Elizabeth says, a lot of these things overlap, right? And so safety in the home could also be safety, the caregiver having a safe environment to provide care. And that ties into what Dr. Kamal was talking about. So yes, we are definitely addressing that as well in Goal 5.
Nice. I want to read off Aviva's and then we'll go to Dakota. Aviva says in the chat, Riverside County RUHS Public Health is working on internal training and community convening around dementia risk reduction, as well as the Healthy Brain Initiative goal domain related to data translation. We are hoping to create public health data products that will support work being done in the community. And so this is an example of an initiative that we didn't necessarily even know was being applied for in Riverside County. And now that we know that the Healthy Brain Initiative is going on and we're connected with Aviva and Aviva was connected with Judith, we're all kind of connected and able to better align efforts now. And Dakota, let's go to you.
So I just wanted to share that I'm in the process of getting my mom's brain donated, which is awesome. But she had Parkinson's, but still, it's good information. She really wanted that to happen. And the other thing was about Greg's comment and in nursing homes, if the training could also include family members, here is how you deal with a nursing home that's not in compliance, right? How do you talk to management or the administrators about the retribution that's happening? Should a resident report something? There's such a power imbalance there, of the residents and then management. And there are I'm aware of some threats being made as far as you will not have a place to live anymore. So that kind of, and of course, it's all tucked away in nursing homes. So we're not seeing it in the public. So I guess I want that to be addressed in the education part. Thank you.
Definitely. And this does sound like a really good discussion to continue on with Goal 5, the safety, respect, and equity, for sure. I know there's ombuds reporting processes for nursing homes, but there's also questions about what that looks like and how effective that is and that sort of thing. So we'd like to definitely carry the conversation on this topic into Goal 5 too, because like I said, Goal 5 is still fleshing itself out and developing advocates and people to support it. So if you're interested in these topics, Greg and Dakota, please come to Goal 5 and give us some ideas of how to build it out further. Does anybody have any other ideas on maybe existing programs that they have in their organization that might be interesting to partner with? Yes, Judith.
I just have a follow-up question to my comments. So let's say that any of those ideas is something that the coalition would like to move forward with. What would be the next step in order? I know that there's something happening in May and there's implementation for the next couple of years. How can we, let's say, move to the next step if let's say that you want to be able to help us increase awareness about age-friendly and about dementia care navigation services that are available soon for caregivers.
Yeah. Do you want me to answer that, Elizabeth?
I was like, I have to unmute myself. The perfect transition. So we can jump to the next slide. Where hopefully I can answer your question, but if you want more specific, we can delve a little more in depth at the end. So there's different ways to sign up as a partner. So if, for example, in Judith's case, the two projects and programs that she presented, sign up as a partner and mention those projects and programs when you're signing up as a partner. The intent is probably around August to begin having implementation meetings with the partners from the various goals to discuss processes of implementation. Maybe we need to apply for funding. Maybe we need to share resources. So discussing what that looks like. And that can only happen if you sign up as partners. I think we're already signed up as partners though, right? Yeah. Another option is to join Inland Coalition on Aging. So sign up via inlandaging.org and get those updates. You can attend the monthly meetings if you want, but that isn't necessarily a sign of partnership. So if you have like solid ideas for partnership like Judith does, then sign up as a partner and let's make that happen. I think Dakota too, you're signed up too, right? So also committing to helping with the IE-MPA implementation. That's signing up as a partner and making that happen. We're going to start with those meetings, hopefully in August, to be able to flesh out what this actually looks like and how we can support it best. Also, maybe you're not working on a project within your organization or within your department, but somebody in another department at your organization or at a different organization is. That would align really well. Connect us to those people. Send over an email to info@inlandaging. We can present to them similar presentation as today, or just talk to them and discuss what partnership could look like. I know I did that, I think earlier this month with Aviva. And so they've been able to attend a couple of these meetings and learn a little bit more what it can look like with each of the different goals. Also attend the IE-MPA launch. If you sign up for inlandaging.org, if you sign up for our email updates, you should get the email that reminds you that the plan is being released in June. Probably towards the end of the month is when we'll have the big release, and it'll send you all the reminders. So as long as you're signed up there, you should be good. And then also you can connect if you have a specific project or grant idea that you want to collaborate on. Info@inlandaging.org is how you do that. I also encourage you just to sign up as a partner and mention in the comments that idea as well. So those are the ways that we can collaborate going forward. But if you want to be listed as a partner in this master plan for aging as it's published, then the best way to do that is to sign up as a partner via the link, which I am going to drop in to the chat right now. And there's no financial commitment if you sign up as a partner. There's no like intense monitoring or anything. It just allows the opportunity for us to be able to follow up with you and to align efforts. So does anybody have anything else that they'd like to jump in and say?